So my very first operation that I did was a 2/3 replacement, or an eye duo. And I'd come back from the meeting in America. I spent a long time looking at all the detail. I went to Germany to get trained. I came back and I waited a long time to find the ideal patient, someone who wanted to live an active lifestyle, who didn't want a standing knee replacement. And then what surprised me was their speed of the recovery, and the fact they could jump up and down off the floor within 5 weeks, go up and down the stairs without holding on, and it was a very different experience than a total knee replacement. The new product is manufactured to fit precisely, and that's based on CT scans, where there is CT scans from the hip through the lower leg to the knee and through the ankle, which helps with alignment, and the detail of that scan is around the knee, which helps reproduce the 3 curves in the knee. This curve here, the central curve and the outer curve, are accurately reproduced to match the patient's own. The side-to-side dimensions fit that exactly. The off-the-shelf knees have been a little bit primitive, and throughout studies throughout the Western world, the patient satisfaction rate is around about 80%, sometimes 75%, sometimes a little more, but broadly 80%. So 20% of patients are unsatisfied, dissatisfied. The custom knee has a lot of detail in its design that just delivers a satisfaction rate of 95%. So there's a quantum jump in happy patients. The main difference is the quality of the outcome. So the number one difference that I've observed is that patients feel like their knee replacement is their own knee. Whereas prior it used to click, or off-the-shelf knees used to click, used to feel a little bit mechanical, a little bit clumpy. Patients would rate them as around about 8 out of 10. So it was better than the pain they had with the arthritis, but it wasn't a 10 out of 10 outcome. I would think that the benefits from the hospital are relatively short length of stay, so most patients are home the night after surgery, so say one night, go home in the morning. And the average length of stay for a knee replacement in the UK is around about 4.5 days, so there's a dramatic reduction in that. With a ConforMIS custom total knee, it moves like their own knee, certainly in the majority of the range of motion, and that's been looked at in studies. And patients feel that, so it doesn't feel unstable. They can trust it and really push it and do as they please without concerns, without second thoughts about how it's going to behave or function. If I was having a knee replacement, I would have a custom total from ConforMIS for sure, because it delivers a stable knee, a knee that feels like their own knee, and a much easier recovery from the patient's perspective.